What percentage of healthcare workers misuse drugs or alcohol at some point of their career? Is it A, 20 to 30%, B, 5 to 10%, C, 10 to 15%, or D, 40 to 50%? The answer will be at the end of the interview. Vaminos. Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kakpomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. All right, welcome back, Vardians. We are here for another interview as promised. But we are here with a slightly different guest today. He is an MD, and I wasn't planning on bringing MDs to you guys right yet, but he's here today under a slightly different capacity. So I'm going to introduce him, welcome him in, and we'll get started. Dr. Simon, welcome. How you doing?
Hi, nice to meet you.
Nice to meet you too. So he's actually not in Cali right now. It's pretty late. So let's get this going so that we can get you back to your son. Tell us a little bit about you and what you do.
Yeah, so I'm a heart surgeon. I've been at it for the last 15 years, give or take. I also have a degree in biomedical engineering. I have a PhD. Where I studied also heart-related things. And then, over the last couple of years, I've had a special interest for mental health, and especially in high-performing environments, and especially healthcare, is because that's what I'm exposed to. And I got a health and life coaching degree to support that, and then most recently got into writing books, and so. This was an interesting last 18 months. Let's put it like that.
Yeah. So how did you get into the mental health space as a heart surgeon?
Right. Well, it always starts with an experience, right? And so I thought I had it all figured out as a heart surgeon, as we all sort of do. I mean, we don't have a quite good reputation in general.
I didn't say that.
Right. But out of a personal experience, I thought I had it all, and then progressively got into personal and professional, I don't say failures, but roadblocks, and sort of decided that I was going to turn it into lemonade, and so wasn't quite sure how to do this. Of course, there was some personal work involved in that, and then just gradually got more and more interested about thinking more about mental health and how it comes together, how you get depressed, how you get anxious, how you get to a certain point in your life, and so decided to speak more and write about it.
Okay. And how long have you been on this journey?
I'd say it started about 3 years ago, where I guess my personal journey was not exactly how I planned it. I was going, as I said, through professional and personal issues, and the book started about 18 months ago, where it really just started to be a journal for me. Try to understand what was going on in my life, and then as I started to speak up about it to others, then I started to collect other experiences, and then one experience led to more experiences, and then finally, after almost 2 years of writing, it sort of came together as a whole. And to me, I always had a problem with, being in the acute event, meaning, depression it comes, but there's a number of underlying issue. Anxiety comes, there's a number. You drink too much because there's a lot of underlying issues. And so I came to describe, and I know it's sort of newer term, but I came to describe what I call healthcare disease. And I described this as a more of a chronic problem where you, as a person, as a worker, learn certain behaviors, learn some cultures, and then you function in an environment where the pressure is high, where you sort of are not necessarily teach how to deal with the pressure of performance, the finances, the hours. And then you start to develop these mechanisms of defense that are not always sort of perfect. And so when the acute issue comes up, whether it's big, professional failure or anxiety or divorce or whatever that means, it's oftentimes a reflection of a chronic problem. And I guess this journey over the last 2 years has really helped me personally understand more where I was coming from, and then I said, well, maybe I need to help others not get to where I was, and so that's in a nutshell where it comes from.
Do you still work as a surgeon?
You mean myself? I'm a heart surgeon, so
yes.
I'm a heart surgeon. I'm specialized in heart transplantation and mechanical heart, as well as in robotic heart surgery.
Okay. And what do you have do you work specifically with any demographic in terms of age, or is it just all across the board?
Well, no, we discussed this in the book. I think men, and I'm not talking about white men or even the differences, because there are some differences between white and what other cultures live within that system. But as a male heart surgeon, what I started discussing is really this. It's really hard to speak up about these issues as a male heart surgeon, and not because of the heart surgeon part, but as a male, I think we're in the culture of no fault, or in the culture of never admitting that we have an issue. And so the challenges that we are faced with are very different than the ones that, I know my wife's a cardiologist and she's a female cardiologist, so female in the very sort of difficult, high intensity world. She also has different issues. And so in the book, we balance these things out. What are the perception of, my wife says she still is taken as the nurse, right? And then as a heart surgeon, I mean, I was always told, especially by male mentors, that it was not okay not to be okay, and it is okay not to be okay. And that sort of that is basically the message I'm trying to get out there, that we need to get out of this mentality that, especially after the last 2 years we've had with the pandemic, it is okay. It's okay to say you're not okay, and to reach out for help and to do those sort of things.
So what's the name of this book?
So the book's called Healthcare Anonymous, and it is anonymous. There's in the middle, there's probably about 20 healthcare providers, from doctors to nurses to technicians to aides, that talk about their personal experiences. And I called it Healthcare Anonymous, not to make a link with Alcoholic Anonymous, but to really point out the life experiences, because I've had to read the book at some point in my life. And you always think that people that have problem with alcohol are outside sort of at -20 drinking in a paper bag. And this book particularly describes a lot of shades of gray, right? The mother who starts opening a glass of wine at 8 a.m., the high performing CEO who drinks on the plane. And so the book makes a bit of a bridge or a parallel with the different shades of gray without any meaning in there, but the different shades of what it represents to be having healthcare disease. And whether I have people telling really compelling stories about how every time they were getting in the hospital, they were having chest pain, really actual chest pain with troponin increase. It's like a bit of heart attack.
Wow.
And then the only thing that really helped, and actually that has a name I learned, but or immune disease, so physical manifestation of anxiety from working in hospitals. And then I have more of a behavioral stories, which are sort of cynicism, moving away from healthcare, being angry. And so that is also a subtle manifestation of more chronic problems. Then I have the usual, not the usual, but the psychological manifestations, so the burnout, the anxiety, the addictions. And then finally, there are some sort of other bucket of divorce or personal stuff like finance or bankruptcy, or that are oftentimes a good measure of how you're able to balance your life, or sort of divide the pie in general, if that makes sense.
So what are you defining as healthcare disease?
So healthcare disease is, to me, a disease in general, and I had to read papers. I don't really understand much, but some of my friends in infectious disease have helped me understand how a disease manifests itself. And so usually there's really three things that are important. They call it the three vertexes, or triangle of epidemiology, where you have an agent, right? You have a host, and you have an environment. And usually these three things need to be, so the who, the what, and the where. And these three things have to be together. So the way I describe the disease is a maladaptive response to any of those three things. So if you develop a certain degree of overconfidence or perfectionism, then the host becomes a problem. Then if you work in an environment, and I help the reader understand some of these factors in the culture of no fault, the fear of failure, changes in the system, the pandemic. And so that's the environment. And then there's the what, is how you interact with it, how you develop those mechanisms, where and how those traits of personality develop, right? And so when you have a disbalance between these three things, that's where the disease becomes physically apparent. And so that's where the burnout and everything. So at least in a shorter sense of it's a disbalance or between those three vertices that creates this nidus for full-blown clinical manifestation of a chronic problem. That makes sense.
So that being said, what is then our alcohol, in a sense, as healthcare providers?
You mean what's our problem? Well,
yeah.
It's not necessarily that. So as a provider in general, you're sort of, and I call it addiction, but it's more of a dependence to work, right? You are trained to think, or to really believe that you're there for 100%, give yourself for others. And that's okay to a certain extent. And it's easy to say, it's easy to not quite know where the limit is. And so that to me is one of the issues. Then another aspect that we talk in the book in details is perfectionism. And perfectionism has a lot of good things. It allows you to study and it allows you to, obtain your goals. It allows you to, but there's a lot of negative things to perfectionism. That is the self-criticism, the feeling of being an imposter, and the always wanting to put things at the background for the benefit of, and so we don't really learn how to moderate this. And to me, so perfectionism is a big conversation in the book. And then I think, and I have a really compelling story about one of my collaborators in there, where it's really hard to get away from healthcare. whether it's just, and I can have examples, but either just leaving your family for a heart transplant in the middle of the night, or taking the shift as a PA or a nurse, or doing this extra case. So that's really invading. But then it's it's the perception of your family and the perception of others. Are you studying all your life? You have this great job, why would you leave it? And not just leave it, but why would you want to change it? And to a certain extent, as a doctor, you have another factor. Now I'm saying it's either harder or worse, but you have the money part, right? The social validation, the sort of say, oh, you're a doctor. What else could go wrong, right? So money to provide, it's a job security. So why would you want to leave it? And so makes it even more hard to sort of say, well, you know what, I don't need all that money, and maybe I want to do something with my life. So I think in a nutshell, that's what I think are the hosts. I think that's what our problems are, but we get into more details in the book, of course.
Okay. And what are some of the solutions that you have found, either in your personal, professional life, or just around you, that sort of helped with that?
Right. We talk about a step recovery program in the book, and I think probably the most important one, and there's usually 5 steps that have helped me personally, which I share in the book. But first one is really to take a pause, and a pause means not necessarily a 6 months out in Thailand, or
Although that sounds good.
That sounds fun. But it could be just taking some time to reflect, taking the time to reflect. And so that is, to me, the slowing things down. And to me, for example, it was, well, I took some time off in Thailand, not 6 months, but a bit less. But I also created time. I was involved with a lot of things. I was a president of this, I was on the board of that. I had, many cases. And so, for lack of better opportunity, I did slow everything down. And so I think that's one critical aspect of it. Then is I think to realize that you can't beat certain things, and you are not God. And for me, that was a big one. But but God, not in a spiritual kind of way, but there are limits to what we can do. We are allowed to cry. We are allowed to feel tired, and that was also a big deal for me. And at the time, I was caught up in the big vortex that I call in the book. But I thought, taking a pause and reflecting on how I should act and what are my limits were important. And then we sort of get into more details about how to and what to do. But to me, one of the last steps, in order to skip a bit through it here, was to give back. And giving back in a certain way, to me, is the book. It's the movement I'm trying to create. It's the the coaching or for high achieving individuals that I'm trying to do. And so that is important. When you start getting yourself and giving, you start being all about yourself and reflecting, because at some point you sort of have to get out back in there, but get to find pleasure or find some sort of fulfillment into trying to see others improve as well. To me, that was a start of recovery. And you'll think it's funny, but one of them is actually virus scan yourself on a daily basis. And that's linked to the healthcare in general, but it's basically to take a moment during the day and say, how am I today? Am I like feeling stress? It can be like 5 minutes every day at the same time. And I try to do it. And if I feel like I'm getting down this road of being tired or stressed, or sort of feeling like things get away from me, then I either intervene, get some help, take an extra session with my therapist, or talk to a friend. And that served me in general.
So as you've been on this journey for a couple of years now, what has been some of your favorite part of being on this journey?
Well, I have so much more energy and things to give. I have discovered the power of and I don't feel like that's a superpower. And people will say, well, that's kind of simple, but the power of having people on your side,
Mm,
and and I wasn't really creating an army around me. I was mostly by being angry or by being tired or want to do it all, and I was basically alienating others,
mm-hmm,
and I feel like, I mean, gradually, as I started to be really just one person and being back to where I'm a whole person when I show up at work, or I take time to, I don't know, sit down, but not just to sit down with the patient, but to truly want to sit down with them, or have time to do it. I found out that there's so much power to have, not a power in a bad way, but there's so much fulfillment to have people around you supporting you, or even through tough times when you have a death, when you have a complication, people are there for you. And so
mm,
whether, so it's helped me in my profession to get better. Of course, it's saved my second marriage.
mm-hmm,
You know, and I feel a bit, um, and I feel fortunate to have someone who stuck, you know, with me and things like that.
mm-hmm.
Um, but it's really improved my personal life to, you know, by thousands of folds. And so, and I realized some things about myself. I don't need the big job anymore. I don't need to resent people that have the big job or give the presentation or publish the other paper. I'm fine where I am, and that's okay. And so that's a journey, but it's helped me being in general. I mean, I'm trying to describe it as really happiness. So I it just made me happy and whole.
Mm-hmm. And for anybody who is listening and might want to learn more about that and get on that journey themselves, what are some challenges you faced?
The challenges, yeah. So the first challenge I say is to make time for all this. I say, and that's an ongoing thing. The second would be to really break the taboo of talking about these things. It's easy to write about it, I found, but it's harder to break the cycle and rallying people behind you to talk about these things.
Mm-hmm,
And it may be the culture, and it's changing. Don't get me wrong. I mean, you see these athletes, professional athletes, very high performing environments that people start
mm-hmm,
to talk about things. I think the movement is there, without any sort of, you know, pun intended, but I feel like, I feel that's one of the challenges. And personally, it's been a challenge. I mean, it's a disease, right? Just like I feel diabetes or other things. I mean, I was trained a certain way. I had this trait of personality. I've encountered during the last 2 decades people that sort of helped me form a certain way my thinking. And so just realizing that it's a chronic thing I got to keep in check, just like any other thing, whether it's alcohol or whether it's other things. It's just continued challenge, and realizing that it's there to stay, I think is key.
mm-hmm, mm-hmm. So what is some things that you do to just get rid of stress, or at least, you know, but cope with your stress?
Right. Well, I rediscovered, I think that probably the most important part is being a dad.
Mm,
I was always busy. I was always traveling for business,
mm-hmm.
always operating cases, more cases. Now I'm just enjoying making dinner for my son. I'm going to ski tomorrow with him. We played
Oh,
guitar
that's
today.
fun.
So I think there's that. And then I've discovered new things, sports, and I'm certainly continuing to explore some of these things like the touring or triathlons. And I got back into playing guitar, which I used to do before all a professional adult career.
Mm-hmm.
And I really sort of hardcore stuff, you know, like like hard rock, like something to make all the angriness get out, uh, you know. And yeah, so, and then take time. I actually now chosen a work that allows a lot of flexibility and time off during the month. and that's, fits my needs for the time being. And so
Mhm.
so that's been very helpful.
How do you feel your work-life balance now compared to before you got on this journey?
Oh, the pie was like, well, the pie was 95% work. It was just work. That's how I validated myself. That's how,
Mhm.
that occupied my whole world. And God love her. My ex-wife, I think, tried and tried to get me to think about other things, and a kid and her and me, and it just wouldn't work until I
Mm.
really hit rock bottom. And then I started to divide the pie better. So my life is much more balanced now and I had to draw the actual pie. I'm coming back to pie all the time because I actually drew a pie,
Mm.
and then work's going to take that much, sports going to take that much, family is going to take that much. And so and family now takes 60% of it now. So
Mhm.
I have a baby on the way. I never thought I would again.
Oh, that's exciting.
It's just I have a lot of things to live for now, where before it was for the next meeting, the next presentation, the next case.
Mhm.
And
Mhm.
that when the problem with this is, I feel if you have the pie always divided in a certain way, right? Everything goes, and it's not like rocket science, but if you're all in on one thing, well, the minute that all in doesn't work, just like these athletes, right? They go to they prepare for all these years to go to the Olympics, and if it doesn't
Mhm.
work, then they just have this big fear of failure, or feeling of failure. And so if you divide it, then you say, okay, well, today I lost a patient, or something happened with work that I'm not proud of, or whatever it is. Then you have home to sort of justify other things. And so you can balance it out a bit better.
Mhm. Mhm. Yeah, that makes total sense. Um, and what is your vision for healthcare, especially healthcare workers, as the subject is about?
Right. And I give some advice, I think, for healthcare workers and for the systems, I think, at the end of the book, that are more of a personal reflection, not
Mhm.
science really. But I feel like a lot of times the environments still, they have resources to help, when you get to a certain point, whether it's burnout or anxiety, or you get caught up with something. They have resources for that, but it's really more of a checkbox still. It's a system that's built around to deal with acute situations. So um, realizing that when you do hit that point, HR should also help people prevent some of these things. And so
Mhm.
giving people more time, or hiring more people, and I know that's kind of hard, but to be able to divide the work a bit better. Maybe allow, sometimes it's really a small thing, but allow some flexibility or some ability for the department or people that work within the hospital to express things. Maybe they want to take half a day to hang out with their kid who finishes early at school. Maybe they want to wear jeans. Maybe they want to have a mini gym in a old office. Maybe
That
they
would be
just,
nice.
right. It's not simple. Everybody could pitch in and get like a couple of weights and a bike in a room, and so
They're
so
going.
I think we think we need these big things to change. And maybe people, I've had a place where we started to do yoga once a week with the office, right? And I'm terrible at it, but people started to do it, and then it
Mhm.
changed. The people wanted to come to work and hang out. And so making efforts, or sort of giving resources to help that, or just being an ear a bit better to some of these issues. And then the system, I think, has to change to empower people to speak up, and that's not always easy. There's this, I think the system unfortunately has changed to performance. A lot of the systems are run by administrators nowadays, which is fine. I think they have their great strengths and things. But I feel like sometimes we focus too much on numbers and on performance, and on on how many cases, what's the bottom line. And there's
Mhm.
so much more things that should be at the forefront and should be celebrated. And so and so that's to me some of the things that that would allow the system to help people a bit better, and help with retention and diminish turnover and that kind of things. From a healthcare provider standpoint, it's all the things that we talked about, plus maybe little things, finding time during the day, things like gratitude, meditate, talking about things. If work doesn't, if work is not satisfying, or maybe that's not the right fit, then that's okay. And so some of these things that are probably a bit more like realistic, down to earth, but are sort of sometimes critical for well-being.
Yeah, no, I totally get that. I had set a goal for myself to go to the gym three to four times a week.
There you go.
But this week I only made it twice.
I can make it tonight.
That is not happening. It's not happening. It's closing in like 30 minutes. I'm like, you know what? At least I made it twice. It's better than nothing.
What I found is gym has to be fun. If it's going to the gym, I mean, I enjoyed it for a while, lifting weights and then being in my world. But now I make a point of, if I go to do a sport for myself, I have to laugh somehow. I have to enjoy it. So I can go to the gym, but I put on full on hardcore music, or I really put something that changed the mood, so it's not just lifting weights and getting out,
Right.
Or some people have mentioned to me going to dance or do some, something different, and I won't do that because I can't dance, but
you gotta try.
Yeah, that's right. That's right. I mean, for a while, I'm doing a little acting now. I did a UCLA adult course, and online is now for the pandemic. It was pretty easy to do, and now I'm on. I mean, I auditioned for some little commercial from some. I mean, I just enjoy getting to learn something different and getting out of my headspace.
Yes, yeah. It's definitely can be boring doing the same thing as much as you may love it, doing it for ever and just repetitively. Repetition for the most part, which is just not the biggest. We are not a bigger fan of it.
I mean, I would have literally died. I couldn't continue like this for another, I mean, at the time, another couple of years, but I couldn't imagine myself doing it that way for another 30 years,
Right. Yeah, no, absolutely. Last question before I let you go. What is, having been through everything you've been through and learn from your mistakes and learn from your experiences, what would you advise to somebody who is wanting to be in healthcare in general, or even more especially wanting to be a surgeon? And what's a better way of approaching it, and so that you don't have the burnout on the unhealthy relationship with work that you may have?
Well, I have a couple of ideas, but I think to me, it's there's probably two things that I feel are probably the most important. First is to probably try to understand where you feel happy, try to maybe picture a time during the year or in the past years, or really make the exercise. I say that usually helps with journaling, and I don't want to, I mean, one of the greatest books I've read recently was Green Light, with Matthew McConaughey, not because it's him, but because of it really depicts the power of journaling. What was I doing when things were going well, when I was hitting green lights, and so whether you're a student, whether you're a young adult, let's try to find what moment makes you happy. And usually when you do that, then you can start to identify traits or things that you do, or traits of character that make you feel happy. And so, and then when you choose a profession, try to apply those traits of characters to what you're trying to do. So I know, for example, I know it's sort of a conceptual issue, but let's say for me now, I know what makes me happy is, doing things for others, listening to people, and heart surgery is probably as far as you can be from that, right? They're asleep, they go in, they go out, you fix a problem. I was seeing patients 5 minutes before, and then 2 days, 3 days after, and then they were home.
Mm-hmm.
I was never seeing them again. So maybe at the beginning, if I would have known that, I would have chosen something different, maybe it's psychiatry, maybe whatever it is, but, try to understand yourself and not be influenced by others.
Mm-hmm.
That's one. And I think
Mm-hmm.
one of the critical things that sort of goes with it is try to find a mentor, and it's
Mm-hmm.
not somebody that is the most publishing surgeon. Sometimes the mentors are not the figures, are not the ones that you think they are. It could be just someone that is really good at what they do. It could be someone that inspires you for other reason because they have to do things together.
Mm-hmm.
And I think, and that's what, through our newly formed coaching company, and I'm just say it's not just me but others that went through similar things. We're trying to be better mentors to people that want to hear it.
Mm-hmm.
And I think those two things are probably trying to know yourself better, try to find what makes you happy and how you are in those moments, and then trying to find really people that inspire you for the right reasons.
Thank you very much. That is all I have for you. If you don't have anything else to add, I will go ahead and send you off to spend time with your son and your wife.
My wife's not here and my son's asleep, so it's all about Simon now.
Or you can do some journaling.
Right. I'll finish my tea and I'll do that.
Exactly. But no, thank you so much, Dr. Simon. I had a great time with you tonight. I'm excited to get this in the ears of the folks, and it's great working with you.
I really appreciate the invitation. It's been a pleasure. Thank you.
Of course. Have a beautiful time in Montana, and when you come to Cali, welcome back home. All right. Bye. She's back, and the answer is C. 10 to 15% of healthcare workers misuse drugs or alcohol in their tenure or during their career as a healthcare provider. All right, I hope you all enjoyed that. Adios. All right, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.